Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Today we'll hear from Novant Health's Dr. David Priest and Nikki Nissen about common misconceptions people have regarding the COVID-19 vaccine and what you should expect before getting vaccinated. Then Shelburne Stevens will tell us the latest about the partnership between Novant Health and New Hanover Regional Medical Center. Stay tuned to learn about valuable health topics with HealthWatch.
I think I'd be lying if I didn't say I did have some hesitancy, but I definitely knew it was the right thing to do. And being able to be patient-facing and in my position where we intubate patients and I'm standing bedside helping with that, it's a good thing to do and it's the right thing to do. And being able to help the community and be with my family and my other patients.
Well, I'm excited because, I feel like I'm doing something to protect myself, help myself. I did have a family member who lost their husband this week to COVID. Wow. So it really made me feel like I'm doing the right thing because we never know. And so I feel good about it. So this, I think, is a great time that the vaccine has come out. And I hope that other people in the community, that they will get to a point that they trust it. As they see healthcare providers receiving it, that they will have a level of comfort that they will be okay with it.
That hesitancy is based in historic healthcare disparities and injustices, and we very much understand why people would have that feeling. Some of the other hesitancies is about not understanding why this seemed to happen very quickly. It hasn't happened as quickly as people realize. Our mRNA technology has actually been being developed over the last decade or so. So the speed of things seems to concern people. Some other people say, hey, I don't want to be first. And what we would say to that is, it has taken 10 years to get here, and a number of things all came together to allow us to have this vaccine quickly. Number one was we had a common enemy. COVID virus showed up. Number two is typically you have to raise money to develop vaccines. In this case, governments and private industry around the world poured in billions of dollars very, very quickly to do this. And finally, we had thousands upon thousands of volunteers who volunteered to be in clinical trials. So when people said, I don't want to be a guinea pig, well, it's too late. Millions upon millions of doses have already been given. You can't be first anymore. So those hesitancies are out there. And sometimes what I'm observing now is they're starting to go away. If you look at some of the national data, you see there's becoming more and more acceptance of the vaccine. I think as people learn more about it, they see other people get it, they become more and more confident about its safety and what it means to them. So we've had a consistent marketing and PR campaign to our communities to say, let us help you answer the questions around COVID vaccine so you can make the decision that's best for you and your family. But we think once you learn about how this vaccine works and the safety profile and the millions of doses that have been given, you're going to find that in all likelihood, you're going to want to get it. I think that's what we're seeing now. Now that community members are being vaccinated, we have received several questions that I thought I would address briefly, just for education of our communities. One is the question we get is, what if I don't get the second dose of the vaccine by the specified day? So we know that we have two vaccine products currently, Pfizer and Moderna. When you get the Moderna shot, you should get a second dose around day 28. And when you get the Pfizer shot, you should get a second dose around day 27. Those dates are not set in stone and they're not magic numbers. Those were numbers that were tested within the clinical trials for the vaccine. You should try to get your vaccine within a window of time around that date. So you don't have to worry if it's not exactly day 21. Try to get it within kind of a 4-day window around that date. Even if you miss that, go ahead and get the second dose because we still think that's going to be beneficial to you. We do get that question a lot. People also ask us about whether the second dose they get is identical in the amount and makeup of the first dose. And yes, the second booster is the same. And you should get the same product as you had before. So there's no difference in the amount and makeup of the second doses. We also get the question is, if I've had expected effects or side effects from the first dose, should I then skip the second dose? And our answer is no. Even if you have expected effects that from the first dose, those are generally temporary. They may be somewhat unpleasant. It's still worth getting the second dose to protect yourself from the virus. And some patients want to know if they can choose which vaccine to get. We think Moderna and Pfizer products they're very similar. They have very similar mechanisms of action. They have very similar expected effects profiles, and we don't preferentially give one over the other. So if you have the opportunity to get either of those products, you should do it.
Well, I'm here. I'm at Novant Health Presbyterian Medical Center. I made it. Here goes. I'm here to get my vaccine today, my COVID-19 vaccine. I have to say, I thought about this last night, and I am a little nervous today. Not because I don't think it's the right thing to do, just because it's new and it's different.
Thank you.
And I'm convinced, though, it's still the right thing to do. I've done my research. I've listened to Dr. Fauci. I've listened to Dr. Priest. I've read the literature from the CDC. I've listened to Dr. Hilbreth at Meharry Medical College. And I know that I'm making the right decision for me at this time. It is so important for me as a mom, as a daughter, as a sister, and as a leader in this organization to really do what I've said that we believe in as an organization. Our goal is to really eradicate, get rid of this COVID-19 pandemic that has been in our lives and wreaked havoc for months now. This is one of the ways to do that. I've made the decision for me today, but not everybody has made this decision, and I think you have to come to your own conclusions. I had to come to my own. When we first talked about getting the vaccine, I have to tell you inside that I said, I'm not sure I want to do that. I'm in a different place today. I'm in this line, and I really believe in what I'm getting ready to do. This is really impressive, the setup here. And I see people that I know, like Julie and Coretta, and I just met Lexi. So it really makes you feel comfortable to have people that you know and trust that are going to be taking care of you. No, I didn't cry. It feels good, and it feels like the right thing for me. Okay, here goes. This is it.
You've got it.
You've got this. Thank you, Kelly. You're so wonderful. Thank you.
May I use a Band-Aid for you today?
Please use a Band-Aid. Band-Aids make you feel better.
Right.
So please use a Band-Aid.
I don't have any exact little characters on it or anything, but
Kelly, I could hardly feel that. You are good. Well, I did it. My hands are warm. They're no longer cold, so that tells me I'm really comfortable. And it wasn't bad at all. Kelly gave me my vaccine, and I don't know if it was her technique or the vaccine, but I just felt a little prick, and it really went well. I am hopeful that I'm a part of eradicating this horrible pandemic.
As David mentioned, we've scheduled over 100,000 vaccination appointments through March. At this time, all of our appointments have been filled, but we want to remind the community that we add appointments each week as our allocation allows. We also have a wait list option for those eligible appointments as they're scheduling to ensure that any who would like an earlier appointment are notified as those earlier appointments become available. Scheduled patients can also check back to see if earlier appointments have been added, and they can reschedule accordingly. So we're challenged in Brunswick County, as we are in all of our counties, with allocation from the state. We have a strong partnership with Brunswick's health departments there, and with our newly announced partnership with New Hanover, we'll continue to work to determine what's the best strategy based on what we have on hand to staff larger and larger events as we get more vaccine supply.
You could envision a situation where an individual was vaccinated, thereby protected from becoming infected or having a lot of symptoms, but within their airway, there was enough viral replication within airway cells that they could spread it. I don't think that's very likely, but we don't have the answer to that. So it speaks to the need, until we have a lot of people vaccinated and a lot of herd immunity, and our rates go way, way down, we want to keep masking. We want to keep doing the same things. People are frustrated by that because they want to be vaccinated and then immediately go off and do what they're used to doing. We don't have all those answers. So until more people are vaccinated, we're still encouraging people to mask. And remember, these vaccines are highly, highly effective, way more effective than some of the other vaccines we traditionally use, like the influenza vaccine. However, even if it's 95% effective, that's 5% that it's not effective. And it, so there's still the potential to spread virus. So the science is out on the ability to spread virus if you've been vaccinated. I think it's less likely, and likely if you did spread virus, it wouldn't be for a long period of time.
Now, let's welcome Shelburne Stevens to learn the latest about the partnership between Novant Health and New Hanover Regional Medical Center. Shelburne, it's great to have you here today on this particular day on this show. I understand it's a big celebration for the month of February, and what better person to talk about that other than the president of Novant Health Brunswick Medical Center. So I would like to spend some time talking about that great partnership between Novant Health and New Hanover Regional Medical Center.
Yeah, we're all very excited. We've been looking forward to this day for months now. We've always had a great working relationship locally with New Hanover, but now to have them be part of the Novant Health family, we're really excited about. There's a lot of work that's going to be taking place over the next 2 years. I don't think people will see a lot of changes immediately, other than continuing the great quality care that both the Novant Health Brunswick Medical Center and New Hanover give today. But over time, we'll start seeing some changes and identifying areas where we can improve the health of the communities and serve those patients that may not have access to care, and just really build a really strong regional healthcare system here in Southeast North Carolina.
Well, how do you go about marrying the two in terms of departments, and How is that going to happen? How does that, I know these are.
We have lots of teams that
Okay,
are organized and that are planning in phases, because you can't do it all at once. I mean, the initial piece is to benefits and get the employees over to Novant Health and do a lot of that paperwork. And then you have to start prioritizing. What's the most important? What step do we go first? Which IT systems do we use?
Oh my goodness, I never even thought about that.
Are there name changes down the road that come? And there is a new regional board that was formed for this region for Novant
Oh, well,
Health.
tell me about that.
Yeah, so there's several community members, some that were on the previous New Hanover board.
Okay.
There's one member from the Novant Health Brunswick Medical Center board, and some new members and physicians that they'll be helping to guide strategy and where we go and where we spend capital dollars for future buildings or renovations for the entire region. So it's really exciting. There still is a hospital board for each hospital that they'll do the legal stuff of physician credentialing and keeping up with quality and safety. But that regional board is really going to help us deliver on the strategic plan for what was New Hanover and then Novant Health Brunswick Medical Center. We're going to marry those two strategic plans together over time and take a regional approach to healthcare.
Now, will there be a connection between the regional board and the board in Charlotte, the Novant Health board? There'll be a connection?
Yeah, there'll be two members of this new regional board from the coastal market, is what we're calling it, that will serve on the parent board of Novant Health. So there will be a voice for the coastal market at that parent company level.
And you did say there will be physicians on the regional board,
There are
correct?
There are three.
Because that's always been the case. I know here at Novant Health, there's always been physician input.
Absolutely, that's been our secret sauce, is our physician
That's
relationships.
what I think.
And the physicians know healthcare, they're helping us to lead, and we need them at the table.
Right. And will we see any like name changes right away or colors or things like that, or is that further down the road?
I think you'll see lots of ads and billboards right away. Name changes will really be up to that new regional board as to what, if there are name changes, what they may be. But again, we've got all these teams that are working about how do we partner together and who might be over this service line or cardiac services and those kinds. And it's going to take time, and we're not in a rush to get into this. We really want to do it right and continue to provide high-level quality care.
Yeah, I think that's a really good idea, not to rush into it. I mean, we've worked so closely as a team between New Hanover and Brunswick for so long, and we share so many patients already that do you think that there'll be more services available to the residents of Brunswick County because of this partnership?
Absolutely. I mean, we'll identify some areas where we do not have enough specialists or we don't have them at all, because there are some patients that we transfer to New Hanover that do not really need that higher level of care.
Sure.
They could have stayed in the community hospitals if we had that specialist here. And so I think down the road, and like I said, it's going to take time, we'll see more specialists coming here to Brunswick, or we recruit, and this is where they work out of, so that we can keep patients locally and save those beds at New Hanover Regional for those patients in our region that really, really need that higher level of care.
Yeah, because I know there are times where they are full.
Absolutely.
And it's hard to get patients in.
Yes.
And so that's why I was wondering if there would probably be more specialists who would be willing to come from New Hanover down toward our area to provide office hours, things like that.
And a lot of that's going to help with the partnership of having UNC at the table.
I forgot about them. Tell me about that.
Yeah, so UNC has always had a residency program for years at New Hanover Regional, but it's been a smaller program. And with this partnership and merger, we're going to be able to grow that over time and have more residents come down for training. And then when they come to the coast and see how Wilmington and Brunswick County is really nice, they want to stay here. And then we can hire them full time. So it's really going to help us in some specialty areas, especially around pediatrics and internal medicine, family medicine, and some other specialties. And again, it's new. We may grow it even further over time, but I'm excited that we're just going to be this regional hub for top quality healthcare here in Southeast North Carolina.
It's surprising to me how many residents who do work here in Brunswick already, that like in our OB program, at Novant Health OB-GYN, we've got so many residents, or they were former residents at New Hanover, and now they're physicians here. So, and they have a great residency program.
They do.
Those people come out so qualified and well trained, and you no longer do you have to travel far to get great care. So, Shelburne, tell me what the strategic plan looks like. What down the road, what are we looking at? What are operationally?
A lot of things today are going more outpatient. A lot of surgeries years ago that you spent 3 or 4 days in the hospital, that same surgery is being done today, but outpatient. So we'll be looking at what we call our ambulatory footprint with this new relationship, and how we have the right physicians and specialists in the right locations to serve the region. And then do we have the right imaging services in the right locations? Everybody do not have to come to the hospital for all these studies anymore. We want to make it convenient and meet the communities. This is a fast growing area.
Yes.
And I've seen it in the 15 years since I've been down here. It's a longer drive to get to Wilmington now than it was 15 years ago. But really do an assessment on data and where we need to build those services. That's really going to be our focus going forward, to meet those communities where they need to be met. Another big piece of that is going to be those underserved areas. How do we bring the services to them?
Yeah, I wanted to ask you about health equity. There's a lot of talk about health equity and how we resolve some of those issues.
Yeah, there's pockets of health disparities in there, and health equity, we want to make it equal and easy and convenient for everyone. So we'll be looking at the region where those pockets are, and do we build a clinic there? One idea might be, do we have a mobile clinic that goes 2 days a week to this location and this location? So I'm really excited because everyone at New Hanover's leadership and with my team and with Novant Health, we're putting all ideas on the table and really how do we
That must be an
figure this out?
interesting think tank.
It is, and not only with getting services to them, but we're all about health as well. So we got to figure out how we get communities to eat better and not go through the drive-through, and exercise, and are there places to go exercise so that they can be healthy and not have diabetes and overweight and all those conditions that we see all the time.
Well, I heard a rumor about a hospital or a facility called Scottshill.
Yeah, so it's on the north part of Wilmington, near Pender County. They have a freestanding ED there and a surgery center. And they're going to be moving some licensed beds up there to build a patient tower at some point to serve that community. That's a fast-growing area up there. So that'll be part of their future growth.
Is that beyond Porter's Neck, or?
Yes, it's right before you get to the Pender County line.
Oh, wow. So we talk about food deserts and healthcare deserts. Is that area considered a desert for healthcare?
There's that area isn't, but it's just fast growing. But there are some other parts they call of North Wilmington that there might be one of those deserts where there's not a grocery store to be able to do that. And New Hanover's been working on that for a long time to try to help that community. So there's going to be a lot there. And I mentioned Pender County. Pender Memorial is part of this relationship. New Hanover's been managing them for years, and we're going to continue that relationship to help serve that community as well. So it's really just an exciting time for healthcare in Southeast North Carolina.
And they still have Cape Fear Hospital, correct?
They do. They do. They've talked about numerous plans around that. I'm not sure where they are right now.
So you briefly mentioned IT systems, and I know that New Hanover Regional Medical Center and Novant Health are on Epic, and maybe there'll be a mixture of the two or whatever, but please promise me one thing won't go away, and that's my chart.
No, it's here to stay. That's just the easiest ticket to use to have access to your information and get your appointments, and so that will be there. Which platform we'll be on, we don't know.
We don't know.
We've got plenty of time.
Oh, that's okay. I don't care what platform, as long as I have my chart. That's amazing.
It is.
And what I like about it is I have one place to go, and I can see my new Hanover Regional Medical Center people, and I can see my Novant Health Brunswick Medical Center people.
Absolutely.
And that is so good that to have all that information in one spot. And so it makes me feel better when I speak to a physician about my husband or myself, and all that information is right there. It's just a great tool.
It really is, and you can schedule appointments, do prescription refills, ask questions. There's just so much that you can do, but that will remain. That is a platform of Epic, and that will always be there.
Well, good.
And there's more technology that'll come.
Yeah.
Healthcare is evolving every day with new technology, and Novant Health wants to be at the forefront of all that. So we'll see a lot more coming down the pike with new technology to help serve our communities.
Well, in a few months after the dust settles, I would love for you to come back and just keep us posted as much as you can about what progress is being made and where we're going.
Absolutely.
So, thank you for your time today. I know how busy you are, and I know how busy the hospital is. And again, thank you all so very much for everything you're doing for the residents of Brunswick County. It's truly a blessing to have it here.
Thank you.
Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit novanthealth.org for more information on Novant Health Brunswick Medical Center, our local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
This is ATMC TV, your community channel. ATMC TV is your community channel, bringing you the best of where you live. Stories about local people and businesses. Staying fit and living well. Coverage of high school sports. And the area's only local cooking show. Tune in to ATMC TV, your community channel, only on ATMC Cable, Channel 3 and HD Channel 910. Watch online at atmctv.com.
Today's households are using more connected devices than ever before. TVs are streaming, smartphones are browsing, security cameras are watching, and virtual assistants are, well, assisting.
You'll need an umbrella today.
As you add more devices, we are constantly improving our technology to deliver the fastest and most reliable internet to your home. So make sure you have enough bandwidth. Get speeds up to 1 gig with high-speed internet from ATMC. It's the speed you need to connect all your devices. Call today.
Merge TV from ATMC is the new way to watch TV. It's your ATMC cable TV package delivered to your favorite streaming device without cable box fees. Plus, get great features like cloud DVR and look back up to 72 hours. And Merge TV isn't just on TV. Watch on your other internet-connected devices too, anywhere in your home, so you never miss a minute of fun. Add Merge TV to your ATMC bundle and save. Merge TV from ATMC. It's the new way to watch.
Getting an alert the kids made it home safely, or need to let guests in when you're not there. That's ATMC Security. And then there's the time when having professionally monitored smart home security really matters. ATMC Security offers remote access, real-time alerts, video monitoring, and interactive security, keeping you connected to your home from wherever you are. Start with 24/7 emergency monitoring for burglary, smoke, fire, and carbon monoxide for as low as $17.95 per month. ATMC Security. Safeguard your home.
When you build your own bundle at ATMC, you choose the services you need, like faster internet with speeds up to 1 gigabit. That means better surfing, streaming, and gaming. Add premium Wi-Fi and get whole home coverage to connect all your devices. Then choose from ATMC's Merge TV, unlimited home phone, security with smart home solutions or wireless, and save even more. Faster speeds, more choices, bigger savings. Build your bundle with ATMC.